Well, April is National Minority Health Month. It is a time to promote and take part in conversations that address growing health disparities made worse by COVID-19, especially in communities of color.
Experts say the pandemic has disproportionately affected many Black and brown communities since the very start. Our Liz Lewin joins us now with some insight into why not much has changed. Liz?
Hi, good evening, Scott and Mary Allison. As you both just mentioned, this is a really important month to start focusing on the inequities of health, and not just locally here in our communities of color, but across the entire country. This year, National Minority Health Month is really focusing on getting more booster shots into the arms of more minorities, which, comparably speaking, is still a big problem.
Right now, the major area in terms of what I consider a primary care deficit is 14215.
COVID-19 continues to shine a glaring light on some long-standing inequities in our community, particularly in communities of color. That's one reason the U.S. Department of Health and Human Services recognizes April as National Minority Health Month, a time when specific emphasis is placed on growing health inequities, all while promoting health education.
You need a trusted source to get information from. And a lot of the minority community, their trusted source is the local emergency room.
We know vaccinations and boosters are life-saving tools against the virus, and yet there's still an overwhelming number of minorities who haven't received either. Dr. Chet Fox, Chief Medical Officer of Urban Family Practice on Buffalo's West Side, says both lack of primary care and lack of representation, specifically in Black and brown neighborhoods, are two major reasons why.
40% of the people on the east side consider the emergency room their primary care doctor. So there's very little health education, health literacy that goes on in poor communities, and that absolutely needs to change. And that's why I'm doing what I'm doing. People like to see doctors that look like them. Jewish people like to see Jewish doctors, Hispanics like to see Hispanics, but even though the African American population is 13% of the population, it's only 5% of the people going into medical school.
And then there are issues like language barriers and transportation.
A lot of people go to places where they're using a translator line, and translator lines are helpful, but it's not the same as talking to someone who can speak your language.
Considering these challenges, Dr. Fox says it makes sense why vaccination, booster, and testing numbers in communities of color continue to lag behind 2 years later. And in terms of boosters, only 41% of Hispanic population and 44% of African Americans have gotten those boosters. Of course, you're seeing greater numbers in more majority groups. So if you are at home and watching this and want to get vaccinated, Urban Family Practice is still offering vaccines and booster shots for those of you who might need them. I'll also note that the Erie County Department of Health is offering free booster doses of Pfizer and Moderna to all who are eligible. We've got all those details posted on our website at WGRZ.com. In the Information Center, Liz Lewin, Channel 2 News.